This will be recorded and available on our website, on our YouTube, sent out to those who registered for the program. So if this is something that you would like to share with a colleague, you'd like to share with your organization, or anyone else within your network, you will have this as a resource in the future. So I'm going to hand it over to my colleague, Olivia, before we hear from our presenters this evening. Thank you so much.
Thank you, Amelia. Hi, everyone. Thank you for joining us tonight. My name is Olivia Knox, and I'm the policy coordinator here at the chapter. As Amelia mentioned earlier, at NASW New York State, our members create our advocacy agenda through participation on our Advocacy and Government Relations Committee, which is also known as our AGR Committee. The AGR Committee serves as the backbone of the chapter's policy and social justice agenda by defining our legislative agenda, creating an actionable strategy, and mobilizing our membership. This year, AGR voted to support New York State Assembly Bill A6346 and the Senate Same As Bill S328, relating to eligibility for home care services under Medicaid, and this is a bill repealer. The committee strongly supports the efforts to change back the law to ensure that New Yorkers are not losing access to vital home care. So please join me in welcoming Kathleen and Athena to share more about why this legislation needs to pass in the upcoming session. I'll pass it over to you, Kathleen and Athena. Thank you so much.
Thank you. My name is Kathleen Downes. I am a social worker by training. I'm also a member of the AGR committee that Olivia just mentioned, and I'm a board certified patient advocate living on Long Island. And I guess most importantly for this topic, I am a home care consumer. And I will let Athena share a little bit about herself as well.
Okay, thanks, Kat. Hi, everybody. I'm so glad to be here. My name is Athena Savides. I live in Brooklyn, New York, and I'm a peer mentor with CDPenny's, the Consumer Directed Personal Assistance Peer Mentoring Program. I work with Downstate New York Adapt, and I'm also a Medicaid consumer as well. Thank you.
Okay, thank you. So we're meeting today to thank the chapter for making the Restore Home Care Access Bill a priority this session, and to tell you more about ways you can help us. This bill was formerly known as A5367A in 2021-2022 and was recently reintroduced in the New York State Senate as Bill A6346 S328 in 2023-2024. Under the Cuomo administration, as the 2020 budget introduced many detrimental changes to the Medicaid home care program under what we call the Medicaid Redesign Team 2. We are focusing on the proposed change that imposes new restrictions for home care eligibility that will deny services to thousands of disabled people. Bill A6346 S328 would repeal the proposed changes. We will explain exactly what the changes are and why we are trying to repeal them. We're also going to elaborate a little bit more on why these changes would be detrimental for the disability community. Olivia, if you could put up the screen share document, that will be great. And I'll pass it to Athena now.
Thanks, Kat. What we have on the screen right now is a portion of the budget law. We're focusing on the change the eligibility criteria for home care and how it in fact impacts our personal care services and consumer-directed personal assistance services. It was passed in the budget in April 2020, but has been delayed because of the pandemic and federal maintenance of effort, or MOE requirements. As you can see, they created two different eligibility criteria. One for those with Alzheimer's or dementia, and one for all others without. So I'm going to pass it back to Kathleen to explain to you the next two documents that we want to present on this screen share. Is everyone able to see the screen share okay?
Okay. Yeah, if you could scroll down to the next page, Olivia, that would be helpful. Okay, thank you. So this here is the Medicaid Redesign Team, or MRT, scorecard. The scorecard lists the alleged savings for Medicaid in New York State based on restricting the eligibility criteria for home care services. So can you scroll down a little bit, please, Olivia? You'll see that red arrow right there with the box. Those are the alleged figures that the governor said at the time would be this would be the money if we put these restrictions in place. But as far as we're concerned, these are pretty much fake numbers because they failed to factor in the pandemic, first of all, which we all know was a mass disabling event and will only create more health problems for people. And the other reason that this figure is concerning to us and not one that we feel you can logically go off of is it fails to consider that when you restrict people's eligibility for home care, they're being set up for institutionalization, which is way more costly than home care. And those who are not institutionalized right away will remain in the community essentially in a no man's land without the help they need. And that drives up the incidence of injuries and hospitalizations, which are also costly. The state's own figures for nursing home care by region range from $169,704 per year in New York City. And then the lowest figure by region is 140,712 in central New York. So those are not low numbers, and those are the state's own projections. So it just doesn't make sense to restrict access to home care when you're simply passing the buck to the nursing home industry, which is even more expensive. Unfortunately, the nursing home lobby has a very strong grip on legislators in New York State. And we want to show our representatives that most people prefer to stay in their own homes. It's not only the moral choice, but it's also the economically responsible one, because the average cost of a home care aide is about $20 per hour, according to an industry survey. So that is significantly cheaper than institutionalizing people and putting them in a facility where they don't want to be and they have no ability to participate in the community, both on a social level and on an economic level. I'm going to give back to Athena, who's going to elaborate a little more on the old criteria versus the new criteria. And you're going to see just how restrictive this new criteria is.
Yeah, exactly, Kat. So thanks. Prior to this change, the eligibility criteria for home care was only that you need to be a Medicaid recipient and need help with at least one activity drawn from the 22 activities listed on the blue section of the screen. So that's the slide that you're seeing right now. Hours are then assigned based on how much assistance is needed to keep an individual healthy and productive in their home and community. It includes about 9 different nutritional and environmental support functions called IADLs, which are instrumental activities of daily living, and 13 personal care functions, or ADLs. IADLs are things like making and changing beds, dishwashing, cooking, etc. And some of the personal care functions are turning in bed, showering, etc. But the language in this budget law, as passed in 2020, now mandates that one would need at least limited assistance with physical maneuvering with more than 2 ADLs. In actuality, this means that you would need assistance with 3 or more ADLs to qualify. And those needs must include, I want to make sure this is clear because it's very important. And those needs must include moving your body. So that means that you would need assistance with physically moving your body in order to complete at least 3 of those tasks, right? So this means that if you need supervision, oversight, or cueing, cueing meaning someone reminding you to do certain things, or set up or putting items you need within reach, or if you need help that does not have to do with physically moving your body, that ADL does not count toward eligibility, and no IADLs would count. That, to go back, would be related to cooking or cleaning, for example, because it does not relate to physically moving your body, right? And so, additionally, ADLs are very specific and body-focused tasks. Only counting ADLs totally eliminates the nutritional and environmental support functions and half of the personal care activities. Furthermore, the budget specifies the ADLs are defined and determined by this evidence-based validated assessment that the DOH, more specifically the commissioner, chooses and approves. On the right are the 7 ADLs that would now be used to determine eligibility. Only 7. Okay? Now if I can pass it back to Kathleen, she's going to go over the uniform assessment system with you. Thanks, Kat.
Okay, thank you, Athena. So, like Athena said, the orange side of the paper with the new criteria, that that list of items is a lot narrower than the previous one. So it's going to be a lot harder to clear the eligibility to get home care services at all. And the new criteria is going to completely eliminate consideration for people who need help with those IADLs or those level 1 tasks like cleaning, cooking, making the bed. So hopefully that demonstrates just how illogical the new criteria is, because home care is a very simple, cost-effective way to keep people who need help with those IADLs in the home and keep them safe from progressing health-wise. And we are really concerned about the number of seniors and people with disabilities that are going to be completely overlooked according to this new scoring formula, which was done in a very secretive manner without a lot of input from consumers. If you could scroll down to the next page, Olivia, I'm going to share a little bit more about the UAS or the Uniform Assessment System, which is that new tool that's being proposed for home care assessments. Again, this was done in a very secretive manner, and it is considered proprietary by the state, and consumers have not even gotten a clear guarantee that they're going to receive their own assessment. This tool has been proposed to eventually determine the hours of home care that we receive, as opposed to the current, more nuanced and individualized method, which was a nurse coming in and using their own clinical judgment to determine what our care plan should look like. The UAS essentially uses an algorithm to spit out a score, and if the person doesn't meet that score, they'll be denied home care. If you can see on the screen, for the UAS, the sample client here, who we called Jane Doe, you can see based on her assessment that Jane Doe actually has an easier time meeting nursing home level of care than she does qualifying for home care. And according to the Olmstead decision, which is a Supreme Court ruling from the 1990s, the government is supposed to be prioritizing the most integrated setting, least restrictive setting. So they should be exploring pathways to make home care more possible for people, and making it easier to qualify for a nursing home than it is for home care is a clear violation of the Olmstead decision. And we are concerned about the impact on disability civil rights going forward. And like I said before, the secretive nature of the UAS is also concerning, especially given that our home care assessment is part of our our health record, and we don't like the idea of a computerized algorithm being responsible for our fate as far as long-term care goes, because we believe that people should be treated more individually, and that a computer can't make these life or death decisions for people without the input of a human looking at it holistically. Furthermore, we are really concerned that these new proposed changes may in fact violate federal guidelines. So there's something from the federal government called the Community First Choice Option, or CFCO. CFCO essentially provides extra federal matching funds to New York State. We get about 6% matching funds, which comes out to approximately 1.5 billion between 2016 and 2019. And CFCO mandates that those IADLs, or instrumental activities of daily living, such as cooking, cleaning, making beds, light housekeeping, must be included in considering these scores. And it also mandates that there be no difference in the type of services offered based on type of disability. And under these new proposed guidelines, the folks with Alzheimer's and dementia actually have an easier threshold than other disability groups. They only need 2 of these items with body focused tasks, and everybody else needs more than 2, so 3. So based on those 2 concerns, we have reason to believe that the MRT2 changes may actually be illegal and could be risking our CFCO funding from the federal government. We can't afford to lose critical federal funding for Medicaid, especially given that we've had a pandemic that again was a mass disabling event. We have people who are suffering from long COVID and the after effects of the coronavirus, and we have people who are aging and living longer than ever. So if anything, we're going to have more and more people entering the home care system, and to potentially jeopardize federal funding at this time would be a really, really silly thing to do, not to mention dangerous. New York State used to be a leader in long-term care and was essentially the architect of the consumer-directed personal care program, and to see us go backwards like this is extremely disappointing, to put it mildly. I think that New York likes to tout itself as being very forward thinking when it comes to healthcare, but this suggests otherwise and is not reflective of a direction that we want to go in as a state. These proposed changes got delayed because of the pandemic, but they are supposed to go into effect in April of 2024, which is why we're working hard to get them repealed before then, because it's much easier to get something repealed before it goes into effect than to try to undo it once it's in effect. I am going to I'm going to pass back to Athena quickly, but before I do that, I see a question in the chat box that I wanted to address.
Yeah.
So somebody asked, does this apply to new people that need home care or all people that need home care? So right now, we don't really have an assurance either way. We've been told verbally not to worry, quote, quote, because the current consumers will be allegedly grandfathered in, but we have no written assurance of that. or reason to believe that we can trust the governor's office on that. And I would like to add that after a consumer is hospitalized, they are subject to a reassessment. So one trip to the hospital or one, injury, surgery, anything that has you hospitalized for a given time, it's likely that you might need a reassessment, and we have no assurance either that these new criteria aren't going to affect the reassessment. So we have reason to believe this could affect any of us at any time. And even if we are grandfathered in, we're not fighting just for ourselves, we're fighting for all recipients. And we do not want to pull up the ladder just because we're already in the system. We want to make sure it's accessible for anyone who might need it. So with that, Athena is going to walk you through some scenarios of how these changes may affect hypothetical consumers and result in what we see as the next public health crisis in the home care arena. So if you could scroll down, Olivia, to the scenarios, that would be great.
Yeah, thanks, Olivia. Yeah, exactly, Kat. Yeah, Carmela, that was a really good question. I definitely agree with Kat there too. So, to better understand the impact of the upcoming changes to personal care services and the consumer-directed personal assistance program, we let's see. Well, Kat, I'm going to skip this part, yeah, because are we going to have people guess? They're muted, so.
So yeah, we these are our four hypotheticals named after the Beatles. And I guess Athena, it might be fun and a little bit interactive to have some people guess here if you think these folks are going to qualify under the new criteria. So
should we just, if you have a guess, you can go ahead and put it in the chat, or that makes sense, I think.
Yeah, you can either drop it in the chat, or if you have difficulty typing, feel free to unmute. Athena, do you want to start with John in the upper left-hand corner?
Yeah, so just let us know if you think who you think out of this list would qualify for home care under the new criteria. So first up here we have John. He's a senior with asthma and respiratory conditions. He requires assistance with personal hygiene, cleaning, queuing for dressing, vacuuming, and dishwashing. This helps him live in a safe and healthy environment, free of mold and pests. Then in the upper right-hand corner, we have Paul. Paul uses a wheelchair and cannot walk. He needs help transferring into his wheelchair as well as other personal care services, such as shopping, cooking, dishwashing, light cleaning of the kitchen, bedroom, and bathroom, making and changing beds, dusting and vacuuming his rooms. When bathing, Paul requires assistance washing his back and hair. Thirdly, we have George. George is blind and works full-time. He needs assistance with personal care to maintain his job and live in the community, including ironing and mending his clothes for work, paying bills, assistance with essential errands, as well as identifying his medications. Ringo has Lastly, we have Ringo. Ringo has a developmental disability. He needs assistance with nutritional and environmental support functions, prompting when to take medication and preparing meals for his modified diet. He uses a G-tube and requires daily setup with his enteral formula and administration. Due to his new G-tube, he also needs assistance with personal hygiene and routine care. So now, in your opinion, if you could chat with us, which of these characters do you think will be eligible for home care under the new criteria? Let's see the chat.
Okay, so I'm seeing a little bit of a mix. Rochelle said John won't qualify. Antoinette said John would unlikely be deemed eligible. Mark said he doesn't think any of them would qualify. Same for Samantha. And the Bridget shared, my feeling is everyone, but perhaps Paul would be left with zero help, and Paul would only get help if he also needs transferring into the shower. Anne Elizabeth said I would guess no on John, Paul, and George, and probably not even Ringo. Okay, so those are some good guesses, but unfortunately, Mark was right on target that under the new criteria, none of these characters would qualify for home care. Because unfortunately for John, who is the first individual in the scenarios, although personal hygiene is an activity of daily living, it is not one included on the UAS, which is that assessment form. Also, even though he needs help with dressing, it is only cueing and not physical maneuvering. And if you remember, the new criteria does not consider cueing. Unfortunately for Paul, transferring on and off of the wheelchair is not assessed because the UAS only screens people for self-sufficiency once they are in the chair. Which is very silly from multiple angles. Some people on a meeting I was on earlier today were joking around that whoever wrote this criteria must think we levitate into the wheelchairs, because in order to get help when you're in your wheelchair, you need to be able to get into the wheelchair first. And if you can't do that on your own, this criteria is kind of like, oh well. Another really interesting and very silly piece of this criteria is the UAS, which is that assessment, specifically says to exclude washing of the back and hair, which is like, because apparently they don't think we need a clean back or clean hair. And it seems like there's just a weird partial exclusion of some very important aspects of bathing. And finally, none of George's vital personal care activities are addressed by the new criteria because they are those IADLs, which are not considered at all. And the things Ringo needs help with are considered only setup help for his feeding tube. And because that is not an activity of daily living that requires physical maneuvering of the body, it's not considered. Now, all of these characters would have been eligible for home care prior to MRT2. So if these new criteria were to go into effect, it would have drastic ramifications for all 4 of our hypothetical consumers here, as well as for thousands of New Yorkers across the state. So if we go back to the character John, we can see he may be forced into a nursing home if he doesn't have enough help in the home. If you don't qualify for home care services and you don't have enough informal support, a lot of folks are going to be left with no choice but to be moved into a costly institutional setting. We also know that institutional placement increases your risk of contracting COVID-19, which can cause a cascade of other costly health problems that will only open the door to require even more help. We also know that institutional care is consistently found to be of lower quality than care given in one's own home. And we also feel that these characters, as well as other real New Yorkers who will be affected by the changes, would have standing for an Olmstead lawsuit. Olmstead is that decision we mentioned before that says you have the right to live in the least restrictive setting. So if the state gets sued, that's another costly outcome of trying to adjust these criteria. And overall, it's just a really bad look, particularly because the Medicaid redesign team 2 originally was presented as something that would never affect the beneficiaries directly. We were told that when MRT2 went into session that it would not have any impact on beneficiary services, and we're now seeing that that's clearly not true. There's also concern for an increase in injuries for those who are left in the community with insufficient care. Athena, is there anything else that you wanted to add?
Yeah, I also was gonna make sure I mentioned you were speaking earlier, Kat, about long COVID and how it's bringing more people into the care system, and we also wanted to make sure we mentioned that these restrictions to personal care services may also affect people with chronic fatigue syndrome, which is similar to long COVID too. So I wanted to make sure I added that on. Thanks, Kat.
Yeah, thank you. So, like Athena was saying, and we've been saying throughout this presentation, we fear that many New Yorkers will be found nursing home eligible, but no longer home care eligible, which runs directly in opposition to the spirit of the Olmstead ruling. It's going to create an environment where home care is no longer the go-to option, as the Olmstead mandate intended. We as people with disabilities and as advocates believe in dignity of risk, meaning that people with disabilities and all people have the right to make their own choices and to try out the setting that they think is best for them. And that includes the ability to take risks, and that's going to be taken away from our citizens if they are forced into a nursing home or if they are left in their homes without adequate care. This is a very dangerous decision for our state to be making when we are in the middle of an ongoing public health crisis with the spread of COVID and other respiratory diseases that we know can have long-term effects. And more than anything money related, you can't really quantify the loss of your personal freedom, your ability to participate in the community and be with other people in a way that you choose. People who are in facilities don't have those options, and I believe that the ability to make choices is something that everybody wants and deserves, whether they have a disability or they don't. A lot of people maybe haven't even thought to consider the seniors in their community to be people with disabilities, so they don't realize that these restrictions could affect their grandmothers and their great aunts and their elderly neighbors as they age. Seniors who need this type of assistance are people with disabilities, so younger people with disabilities and seniors who will eventually need support as they age are fighting the same battle here. So we are asking that you join us in letting your representatives know that they need to support Bill A6346 and S328, otherwise known as the Restore Home Care Access Bill. This is very, very urgent because they are threatening to implement these changes as soon as April. We do have, you know, a lot of people supporting us. This is a bill that has bipartisan support, and it is currently sitting in the Ways and Means Committee in the Assembly and in the Finance Committee in the Senate. Earlier in the year, around May, it was unanimously supported by the members of the Health Committee. So that's great news, but we need as much help as we can get to move it through the Ways and Means Committee, the Finance Committee, and get people talking about this so that these dangers can be corrected before they wreak havoc on our people with disabilities and seniors. And hopefully New York can take back its place as a leader in long-term care very soon. We recognize that these things cost money, that long-term care costs money, but we view investment in people's health and safety and in their personal freedom to be a sound investment. These programs exist so that people can use them. They have the right to use them. And we do not see making it easier to get home care as a bad thing. We should want people to use these programs that are literally there for them when these needs arise. So with that, does anybody have any questions or any comments?
I did see a few questions. Oh, Gerald's hand is up, so we'll go with Gerald first.
Hi, Athena. Hi, Kathleen. Great presentation. My question is the is the is the nursing home industry, do they have any talking points? What is about this? And usually they try to slide this in like this is better because. Do they have something like that out in the public?
So, Athena, feel free to add something else if you have it, but like I'll be completely honest with you. In my view, this was all about money. The governor, so it was Governor Cuomo back in 2020 when this was initiated. He was very like trying to make it seem like, you know, Medicaid was just bankrupting the state and it's an emergency. We need to cut costs here. But his approach is very penny wise and pound foolish because people are never going to stop needing care. Um, just because we make care harder to get doesn't mean that they're going to stop needing it. So if they don't get it through the home care system, they're going to wind up needing it through the nursing home system, which is infinitely more expensive. And we all know that a lot of the money in the nursing home system uh, goes to nursing home executives rather than actual care. So um, yeah, I mean, Athena, if you have anything to add, but I believe that this was purely a somewhat selfish financial decision that was not looking at the big picture because on paper it's like, oh, look, we saved so much money, but not thinking about ways that costs are going to accrue when you set people up for needing to be institutionalized.
Exactly. I totally agree, Kat. I think the main thing to keep in mind, to remember of what you said, is just because we make care harder to get doesn't mean people are going to stop needing it. The needs don't go away. It's like you know, they can try to ignore us, but we're still
And
kind of
And unfortunately, Governor Cuomo was during his terms very unfriendly towards Medicaid and towards the disability community. He sort of set in motion this culture of Medicaid austerity that has unfortunately continued. And um I feel that people with disabilities and seniors and all those who need any type of long-term care are being scapegoated for costs. But the same politicians are unwilling to address that nursing home executives are making multi-million dollar salaries. The state has willingly introduced managed care organizations, which add another costly layer of bureaucracy. So if they're looking to save money, there are easy ways to do it that don't punish the clients. And instead, they've chosen to blame all the increased costs basically on people needing care, which is the whole point of the program. And they have chosen not to look at those administrative costs. And unfortunately, the New York State nursing home lobby is one of the most powerful in the country. And a lot of these representatives, including the governor, get lobby money from nursing home executives. So we're up against some very powerful people, but they need to understand that not only is this an immoral thing to do, it's very financially foolish. And I saw something in the chat. Somebody asked if this will affect seniors as well. yes, this is going to affect anyone that is looking to get home care. A lot of seniors who were once non-disabled or able-bodied sometimes hesitate to think of themselves as a person with a disability, but if you need home care, you know, welcome to the disability community, and these criteria are going to affect anyone who applies going forward. So I see some other hands up if we want to take another question. Tiffany?
Yes, hi. My name is Tiffany Luciano. I work for the Independent Living Organization, and I'm also someone who needs home care aides. And this is really concerning. You said something about that some people could be grandfathered in. What does that exactly mean if you get grandfathered in?
So grandfathering means you're already in the system, so we'll we'll keep you there under the old criteria. And we've been told verbally that that will be the case for existing home care consumers, but we have no written assurance of that. And it also
Okay.
doesn't take into account the issue of reassessments. So if an existing consumer goes to the hospital and they need a new assessment, logic would point to they're going to use the new criteria. So even though they're saying that existing consumers are safe, we don't really have reason to believe that's true. And even if it is, we continue to be concerned for new consumers as well, because I think it's important for us as a community to not just look out for ourselves as existing beneficiaries, but also for the future of the program to make sure as many people who need it can get it. And I like what Kim shared in the chat box. So Kim said Governor Cuomo also believed that Medicaid was rife with fraud. But contrary to what he may believe, fraud is mostly perpetrated by providers rather than recipients. Again, these managed care organizations are often pocketing money that's supposed to be going towards care recipients, or they're giving their executives huge salaries. So Governor Cuomo may have been onto something about fraud, but in our opinion, if any fraud exists, it's more than likely coming from corrupt providers and managed care executives rather than recipients. But unfortunately, the recipients, because they are vulnerable, are easy targets. And we often get blamed for things that actually have to do with bureaucratic waste. Athena, did you want to take the next question?
Oh, sure. Before we started with the questions, we were looking at the presentation, so I couldn't see who was first. So we'll go with Alexi.
Hi,
What did you say? I can't hear you.
okay, can you hear now? Sorry.
Yeah. No, it's okay.
I have a question. I know there's two programs right now. There's is it will affect the, you think, nursing home diversion program? There was a transition program that was designed to help people to come out of nursing home, but also keep people in the community in terms of not to get into nursing home. I know it's a smaller program. And then like nursing home transition program. I mean, that would be just another option, even though it's limited. But the other question, like, there's also PACE program. And I know PACE has not been mentioned a lot because it's usually you have to have both Medicare and Medicaid. But they also provide, home care. I mean, it's a total package in terms of home care services, but also medical providers through the PACE program.
So NHTD, which is nursing home transition and diversion, that's actually a Medicaid waiver, which is essentially like an expansion pack on regular Medicaid that focuses on a specific population. And even people who are in waiver programs may be using personal care services. And in order to get personal care services, whether that's a traditional agency model or consumer direction, they're going to be assessed under the same criteria. I mean, I know people that are NHTD waiver recipients, and still, if they are looking for personal care support, it's going to be through, the programs that are assessed under this criteria, because often, waiver programs will, provide services that are specialized to a certain diagnosis group, but not necessarily like custodial care. So these waivers usually work in tandem with the home care system. So yes, those in waiver populations will be affected too. Like, for example, I have a developmental disability waiver, but the developmental disability waiver provides things like community habilitation, which is basically like support for independent living goals. OPWDD does not cover personal care tasks, and those are funneled through the regular Medicaid home care system. So even though I have a waiver, I still have to get my personal care support through this other channel that is under the auspices of this new criteria. Athena, did you want to add anything?
Yeah, thanks, Kat. I was just gonna say, yeah, these criteria are related to this, like the services and needs that you have, not to where you're getting them from. Like, I don't know if that makes more sense, but this, yeah, it's related to the actual tasks and needs, not like the waiver itself. Does that make more sense, Alexi?
Yeah.
Okay.
Yeah,
Okay. Sounds
yes,
good.
that. What about PACE program? I mean, a PACE is usually for Medicare and Medicaid component, and they also provide home care. Do they also have to follow the same rules, or
Yeah.
they still
Oh, sorry. Go ahead.
no, or
So
they still have more, or they have more of a their own approach to because they because they are more in terms of because they have to have both Medicare and Medicaid, and they have to be locked into their network providers and attend their daycare center. But with PACE, you're still eligible for home care, and they do have sometimes they've been providing in the past 12, depending on the client, on their patient's needs, and also kind of try to prevent and continue to keep them in the home. Do you think that with PACE programs, they also have to meet those criteria that's under that's ways of Medicaid as a
for
side?
For ongoing personal care support, yes. So
Okay.
Medicare, Medicare may cover some very limited home-based tasks, like some very limited visits for some skilled tasks, like maybe monitoring of vitals or things like that. But if you need help with things that are more custodial care, like bathing, dressing, feeding on an ongoing basis, that's Medicaid personal care services. And all Medicaid personal care services folks have to follow the same criteria, and that's what's slated to change coming up. Within Medicaid personal care, you have a choice to either go through an agency where an entity will send an aid for you, or consumer direction is you can hire your own person, so family member, friend, person you hire from the community, and it gives you a little bit more control. But regardless of what model you choose, it's all under ongoing personal care services, which have to follow criteria. So I see Elizabeth has a question.
Well, you've sort of kind of answered it. I guess my bigger question was, what the heck were they thinking when they did wrote this? I mean, because who's going to make money now? I mean, because it's clearly not going to save money for Medicaid, or I guess it could if they don't give any services, but that there's going to be a big. Is it more money? It feels like nursing homes don't have any problems being filled. I know people who waited weeks and months to get, in rehab when they, to get a spot in nursing homes. So I guess I'm just curious, what do you think? I know you've mentioned several times that these proposed or these rules were not discussed openly with consumers and gotten a lot of feedback. What do you think the thinking is on it?
I mean, Athena,
Yeah.
what do you think?
I mean it.
I'm about to have a very cynical answer, but
Yeah.
what do you
Okay.
think?
I mean, it's like you said, Kat, right? They were trying to save money, but the thing is that they won't, because if more people are going into nursing homes, more
Right.
nursing home care is more expensive
Right.
than in-home care. So
Right. It
And
makes no sense to me. Sorry. Go ahead.
no,
will
definitely
make-
not. That's why we have this bill.
it will make money for high-ranking nursing home executives.
Okay. All right.
And unfortunately, they have big wallets, and I would like to say that our legislators are always, concerned with what their voters want, but more often than not, they're interested in what lobbyists want, because they're getting paid by them. And when you have a group like Medicaid recipients that don't have a lot of money, people with disabilities are, disproportionately living in poverty. And in order to qualify for Medicaid and get home care, living at or below the poverty line is sort of built into that. So we're an easy population to scapegoat, and nursing home executives are extremely powerful in our state,
Wow.
especially. So who represents the 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 home care industry? Well, So home health aides can join the Healthcare Workers Union, which is SEIU, but unfortunately, SEIU is the same union that represents some of the nursing home workers. So in my opinion, there's a bit of a conflict of interest there. And a lot of the true interests of home care consumers are, represented by grassroots disability groups like Capital Region Adapt, Downstate New York Adapt. Athena mentioned the Consumer Directed Personal Assistance Association of New York State. We have independent living centers. And yeah, it's unfortunate that we don't really have, very many high level officials that are truly looking out for us, but we the grassroots advocates are fierce, and we are not going down without a fight. And some of the organizations that I mentioned are working around the clock on these kinds of issues. We also recently had a memo come out from the New York Legal Assistance Groups, which is one of the leading legal advocacy groups for home care recipients and seniors in New York City. They are some of the brightest legal minds that I have seen out there on Medicaid issues. So this is definitely on people's radar. We just don't have quite as much money as some of the competing interests. And that's why we need as many people as possible to be heard on this and let people know that we see what the nursing home industry is up to, and we're not here for it.
I agree.
And I agree, Mark, too, that I would say there probably is some fragmentation within the different sectors of the industry. I find also that a lot of times the voices of people with disabilities and recipients kind of get drowned out or spoken over by providers. And some of these managed care organizations that claim to be looking out for us seem to be more looking out for their own salaries. So, yeah, we're up against a lot of powerful forces, but I truly believe that the law is on our side here, and that we have a very clear case for what's wrong with these restrictions, and that there's still time to fix it.
Yeah, and thank you, Olivia, for putting all these links in the chat to your memo of support, and also our the Act Now letter for everybody to sign on, to tell their legislators to look into this repeal bill and to sign it.
And if you want to read more about this, you can also check out the DNY Adapt webpage. That's D as in David, NY ADAPT.com, and we have a little web section about some of the past work we've done and upcoming. You can find a little one-pager on the bill, as well as a little video of some of us talking about this. If you punch the bill number into Google, you'll also be able to see the bill's progress and some of the people who are currently sponsoring and co-sponsoring. Our lead sponsor and supporter on this is Senator Gustavo Rivera. So we'll be following up with him to consult on some strategy, and hopefully we'll move through finance and more people will see what a big problem this is going to be.
Definitely, and I just wanted to let everybody know, we just have to always, cite our sources. I just wanted to let everybody know that this was the presentation, the slides you saw were made by DNY Adapt. So that's where the information came from. Kat and I did not just produce everything ourselves, so just transparency.
Yeah, we've had a lot of help from the great folks at Downstate New York Adapt that we're both involved with. We've had a lot of help from Consumer Directed Personal Assistance Association, from the Independent Living Centers, and hopefully now all of you.
Exactly.
I see that. I think Bridget or Brigitte has their hand up.
Okay.
My audio working? We can't hear you, Bridget, though. But
Not well.
you want to put your question in the chat? Thanks.
I just want to take a moment to say thank you so much to Kathleen and Athena for this wonderful presentation. I know I learned a lot, so we're hoping to get our members active and advocating for this bill. We will be advocating for this legislation at our upcoming Capital Action Day in February. Capital Action Day is the day to get together to advocate for policies at the state capitol here in Albany that will help us provide better services to our communities and better serve the profession and the overall health of New Yorkers. It is open to everyone, and I will put a link into the chat for more information.
Thanks so much, Olivia, for your help with the slides. This was great, and for putting all this information in the chat again. I'm going to sign on now before I forget.
Yep. Thank you everybody for coming, and we hope that you'll stay involved, and definitely the calling those representatives, especially those that are on the finance committee and ways and means, and hopefully we'll have some good news going forward during this legislative season. We'll definitely be ramping up after the holidays.
Thank you, Athena. Thank you, Kathleen. And I just wanted to mention again that this program is recorded. So we'll have that up and available for folks to send it to anyone that you think, anyone that you think would be interested in the topic, or that that it's important to. We want to encourage folks to send the act now to your colleagues, to your peers, to your your supervisor or your employer. This is really important. And in addition to the act now, also for our capital action, we'll be advocating on this topic as well as other topics that impact social workers and their clients, including social work loan forgiveness and social work salaries. So we encourage you also to share that information with your peers, with your colleagues, with your employers. It's really important to get as many folks engaged and participating in this as possible. So thank you, everyone. Again, thank you, Athena and Kathleen, and have a wonderful evening.
You too. Thank you.
Bye-bye.
You too. Thanks so much.